You know, trust is something that you feel in your gut. It's not something you can convince somebody of with your words. It takes time to develop that trust. So he comes home, they get in this huge fight. It turns out he wasn't out drinking. It turns out he was late at work. Should have called, but didn't. They get in this huge fight. So then in this little story, another month goes by, and he's supposed to be there one time at noon. She looks at her watch, 12:30, 1 o'clock. What does she say?
I'm drinking.
That SOB, I knew it. He's out drinking. He comes home, they get another fight. Not quite as big as the first one. What do you expect? 20 years. It's a long time of sneaking around. You know, trust again is something you feel in your gut. He feels like saying what? He feels like saying, you know what? Why bother? Here I am. I'm going to my meetings. I'm doing what I'm supposed to do. She still doesn't believe me. I might as well go out and drink. So it's very important for both people to understand the process of trust rebuilding. It takes time. So in this little story, maybe, I don't know how long it takes, 3 months, 6 months, a year, I don't know. One day she looks at her watch and says, 12:30, 1 o'clock. Maybe he's late at work, or maybe he had a flat tire on the way home. You know, the first thought in the head isn't he's out drinking. You know, I don't know how long that takes, but it's very important for people to understand the process of trust rebuilding. Sometimes I have family members come in and they say after the first week, oh, I trust them. I don't believe them. I don't believe them. It takes time. Other factors that determine, someone asked who gets well and who doesn't, and another factor, a big factor that I like to point to is this last one, aftercare and time in treatment. You know, treatment takes time, as we talked about, and the studies showed that if you go through a good treatment program and you get into a good aftercare program, meaning go to a group therapy or support group once a week and go to some AA meetings along the way, and you do that for a year, people have very high success rates. Studies show if you do that for a year, get involved, go through treatment, get in an aftercare program for a year, 85% 5-year success rates, not 1-year success rate. That means if you look at those people 5 years later, 85% of them are sober. That's for people who go through treatment, stay in aftercare for a year. So that's what we try and encourage people to do. If you look at people, I think this gentleman asked, if you look at people who just walk into the door of AA, they're, you know, overall, I don't know what the rates would be, they'd be low, like, I don't know, 10% or something, because a lot of people walk in the door and never come back. Some people do, and AA works great, but you have to go, you know. So if you follow overall the rate of people that show up, it's pretty, and stay sober, it's low. But if you look at AA, it's still the most successful program. People that stay involved for a year have very good success rates.
When you talk AA, you're talking narcotics also?
Narcotics, yeah, I'm saying AA, but the 12-step program, whether it's Narcotics Anonymous, Cocaine Anonymous, Gamblers Anonymous, Alcoholics Anonymous, 12-step program.
One thing you haven't mentioned anything about marijuana. Is that intentional or just?
No, it's just, I consider marijuana a drug, just like cocaine or opiates, or, you know, I have some slides on opiate and prescription pill addiction coming up, and marijuana in my mind is a drug. I use it synonymously. Marijuana is a drug. It has a withdrawal syndrome that's identifiable. It is associated with changes in your nervous system, reaction time, and
is it addictive?
It's an addictive substance, yes. And you know, the problem people have with it is that the reason people ask that is because the withdrawal syndrome is not really clinically observable. It's like people might say that LSD is not addictive either, because if you stop using LSD, you don't have any withdrawal symptoms that are observable. You may have some flashbacks and memory problems, and you may see some things, but if you look at the person, you'd never know they were having withdrawal. Studies, for example, show if you're smoking marijuana a long time and stop, your pulse and blood pressure change subtly, right? And because it's not an overt withdrawal, people sometimes think it's not addictive. But marijuana is an addictive substance. It's also a big, thank you so much, I needed that, appreciate it. I should have brought some right here. excuse me. So yes, it is, and there's a whole discussion of it, as you know, about medical marijuana and all of that. It's also very much a gateway drug. You know, people say a lot of people smoke marijuana, and it's just benign.
Yeah,
if you
better than alcohol.
Yeah, and if you talk to people, if you take addicts and look backwards, and ask them what percentage of them started with cigarettes and marijuana, you'll see a very high percentage of them. So it's considered a gateway drug. It's not that everybody who smokes marijuana is going to become an addict. It increases your risks for sure. But if you look at addicts, almost every one of them has smoked marijuana as a way that's earlier in the, when they were younger. So it's a gateway drug. Now I can go on and on. I don't want to hold you all. I mean, it's Ann said an hour. I have another. I can go on to my opiates and alcohol with young adults if you want. I'm happy to do that, or I can take questions, whatever you'd like to do. You want me to keep going, or I don't want to keep people past the time? Yes, sir.
The peer pressure, how important is that, particularly in young
adults? It's a very important factor. Actually,
can
one
you
study.
Prepare for that? Can you prepare a kid to avoid that?
It takes a lot of education and support. Yeah. And in this next section, I talk a little bit about that. But you know, there was a study done in the late 80s, 90s that showed that young adults and adolescents, the #1 cause of relapse in young adults and adolescents was old playmates and old playgrounds. In other words, hanging out with their friends. You know, and so peer pressure is a real big issue. You want me to go on? I mean, it's up to you. I don't want to.
How do you crack the nut of the person who's addicted finally realizing, yeah, that aha moment? Yeah, how do you get past the person that's always in denial, that says, I'm okay, everything's fine, I'm doing great, yeah, I lost my job, but I'll play cards and I'll make money playing cards. How do you?
Usually,
does it take some significant emotional event for disaster have to strike?
Unfortunately, usually it takes some combination of consequences, whether it's you know, emotional, physical, spiritual, marital, financial. You know, usually the consequences sort of build up, and you know, sometimes there's enablers in people's lives too. So, for example, I've had a trust funder, you know, a 28-year-old who's got a bad alcohol and drug problem, and his family's got literally millions and millions of dollars, and so he's able to avoid a lot of the consequences because of his financial status, you know, buying his way out of problems, dealing with legal problems through fancy lawyers, you know, and he's able to avoid a lot of, he doesn't have to worry about a job, you know, so a lot of times, in this example, I'm giving you money as an enabler, you know what I mean? So there's a lot of different things. Sometimes you have a parent that enables you, a job that enables you, a spouse that enables you. So a lot of times it takes some of those enablers growing and getting to the point where they stop enabling in order for some of those consequences to surface to the point where he's saying, okay, I obviously have a problem. So sometimes it's not just him, it's also sometimes the environment and family life, you know, family issues. So, but you know, we'd like to say, you know, a way to think about it is, I like to say there's an alcohol or drug elevator. It's sort of a strange elevator. The reason it's strange is most elevators go up and down, but the alcohol and drug elevator only goes one way. It only goes down. So you get on the elevator, meaning you're drinking and using, it's going to go down. There's going to be consequences. So you hit some sort of bottom. You can get off on any floor you want, but if you're not through yet, you get back on, you get on some more floors. So eventually those consequences will get you. And for some people, like I talked about earlier, some people can drink a lot and have very few physical consequences based on their genetic predisposition.